It's not just a habit that the person is carrying on from the generations before.
Okay, what I really kind of want to know too is blood pressure.
Yes, ma'am.
You can, it's not always genetically,
Very true.
Right, so I've lost weight and I eat right, but my pressure I'm still on medication. I hate to go back on medication. So is that genetic, you think?
But let me tell you one thing. I had several patients in the office. One in particular, I'm going to tell you two. One in particular is a gentleman who came in when he was 29 years old. Okay, he had a accident when he was younger, and it affected his kidney, the arteries with his kidney, his renal arteries, and so it caused his blood pressure to spike. Now, let me put this disclaimer. I do not recommend what this gentleman did. I do not agree with what he did, okay? So I'll put this out. But his blood pressure would be 200 and something, over 100 and something. He would take the blood pressure meds, and then it would be 150 something, over 90 something, something like that. He got tired of taking it, so he stopped taking it. That's dangerous. He just stops taking it. Because the way that medication is designed, it should be weaned off. It can actually cause more harm if a person just stops. Okay? So I did not know that he stopped. He just came in and told me that, yes, occasionally I have blood pressure. All right? This gentleman, by correcting, this is what I was talking about with the nervous system, by correcting the misalignment within his spine, it freed up his nervous system to function the way that it was supposed to. He went into his primary care physician, and you know what his blood pressure was? 120 over 74. Had a 63-year-old woman who was on 5 different medications to help regulate her blood pressure once again. It just was not regulating. She's taking 5 different medications, feet getting swollen and everything, and it wasn't regulating. A friend of hers actually paid for her to come in, and this was less than a month. She is now off of 3 of the medications. She's only on 2. So with the patients that come in with blood pressure issues, I advise them, look, the worst thing you can do is just stop taking the blood pressure medication.
Yeah, no, because my brother
died. Yeah, that's too dangerous. The way that it's designed, you do not want to do that. But you can work with your primary care physician. The way that I recommend it is work with your primary care physician and allow the person to know, look, I would like to be weaned off of this medication. Okay? So it takes a step on the patient's part also. You have to document what your blood pressure is. I checked it in the morning, I checked it in the afternoon. We had one patient who, within a year, now her primary care physician took her completely off of her blood pressure meds. And it's
sometimes it can be seasonal too, huh?
Exactly.
Because like if you had an injury and it generates pain, because
pain
the pressure
spikes it up. It does. It does. Yes, sir.
Well, what about lower back arthritis? Lower back?
Mm-hmm.
What is that? Does that cause surgery or what?
Well, I try to help people avoid surgery. If it's allowed to continue, it can cause surgery. Because with arthritis of the spine, it's basically the same thing that we described in the neck. It's the degeneration. So the disc space, what degeneration is when the joint space decreases and there's additional bone formation. Those two characteristics together makes arthritis of the spine or degeneration of the spine. All right? So the key thing is to change the abnormal body mechanic to correct body mechanic so that the body has an opportunity to heal itself.
And chiropractic treatment would help with that?
Yes, ma'am. Chiropractic is excellent for that. From infants to 120 plus.
What about the degeneration?
Degeneration and arthritis of the spine are one and the same. It's the same thing. because arthritis is a degenerative process where the joint space decreases and the body lays down additional bone formation. And it's inflamed in that area.
And exercise help with that?
Exercise can help, yes. However, you have to make sure that the structure is correct, because it's the same as building a house on unstable foundation. You need to make sure that everything is where it's supposed to be. Exactly. You can put gold toilets in there, but if the foundation is not secure and balanced, then it throws everything out. Yes, ma'am.
I have arthritis, and I was wondering, can it be something that can be caused by stress or the type of work that you do?
Stress is a very huge part in arthritis, because let me just go through a scenario with you, okay? Let's say someone works at a desk and they're under a lot of stress, okay? And so they're typing at the desk. What happens? Muscles start tightening up, all right? So a person may start feeling the shoulders going to the ears, all right? What happens when these muscles start tightening is it starts to straighten that curve, all right? So the person starts losing the curve within the neck. Now that creates abnormal body mechanic, right? So now the body has to compensate for that. It's like, well, I'm supposed to be carrying the weight back here. It's not going. So if that continues and continues, then next thing you know, the disc space within the neck starts to decrease. Well, if the disc space is decreasing, then the body now lays down additional bone. And what does that create? Arthritis.
So can certain types of foods and exercise help to correct the problem?
It can, provided that you give the body an opportunity to communicate correctly. If your nervous system is involved, you have to remove the interference from the nervous system. The way that you remove the interference from the nervous system, because keep in mind, you have your central nervous system, which is your brain, your spinal cord, right? And then you have your other nerves going, your peripheral nerves, all right? Now, within that brain and spinal cord, you have the skull and you have the spinal column, which protects it. If they are not positioned correctly, then interference now is introduced into the nervous system. You have to remove that interference from the nervous system so that it can effectively communicate between your brain and your body. So, exercise, excellent. Food, excellent. But you have to remove the interference from the communication. Just as if we were trying to build a house. We have the blueprint for the house. We have the raw material for the house. But I don't know what kind of house you want. If the communication is not there, you're not going to get the end result that you need. See?
So how did you do that with your body?
Well, you don't do it with your body. I do that in my office. Do an assessment and the adjustment. Yes, Mr. Williams.
We spoke of the good bacteria in the intestines.
Yes.
How do we go about replenishing?
That is through the probiotic. This young lady over here mentioned it.
Costs like $30 or more for put it in the refrigerator, take it, but yeah.
Yeah. Okay, I do carry the probiotic that I use. You can either use, there's pill form, there's also liquid form. I tend to like liquid form. The least amount of pills I have to take, the better for me. Just because, it just seems like pill. Liquid, yes. The one that I use.
When you sell it?
Yes, ma'am. In my office, we have probiotic. The one that I use is a spray.